Good morning. This is quite a crew for 7:10 or 7:15 in the morning. Dedicated physicians. My name is Rose Kopleski. Many of you already know me. I am married to Dr. Steve Kopleski, and we reside in rural Simmsport, Louisiana, a town of 2,500. Of course, we do serve a large rural area that surrounds the town. We have 8 children, and yes, I had all 8. And we have a family practice clinic. You can kind of see the front of it there. That's right adjacent to our home. So we are on call 7 days a week, 24 hours a day. People just come right up to the door and say, "Are y'all open?" "Oh yeah, it's just 10 o'clock at night." "Sure, we're open." I want all of you to know that not only have I not practiced clinic nursing before we opened this rural health clinic, I had not practiced rural health clinic nursing, and that has been an incredible challenge. And thank goodness for my wonderful teacher, Dr. Kopleski. He has taught me so much. I thought it was a little beneath me, to be real honest with you. I had been an OR supervisor for years, and I have learned more about pathophysiology and pharmacology than I have learned in a lifetime of nursing after about 38 years. I started when I was really young. Yeah, that's why it's been so. So, hot topics in medicine. In the trenches. Issues and trends in rural medicine. First of all, how many of you are physicians? I think everybody. I just want to make sure I don't offend anybody. There are 3 main issues that have been challenges for our practice in rural medicine, and I wanted to share those with you. Legislative, financial, and what are we doing to survive? What's happening in the rural areas? First of all, legislation. There have been, just recently, I found out before I came here, that there's a proposal from the Veterans Affairs that NPs or APRNs will stand alone as providers for the VA hospitals, regardless of state laws. Louisiana State Medical Society supports physician-led medicine and strongly encourages the Department of Veteran Affairs to consider the long-term implications of this policy. The quality of patient care should be of the utmost concern. If this proposal passes, it will set a trend of autonomy for nurse practitioners, not just in the VA hospitals, but everywhere. Jennifer Manchak is our Vice President of Governmental Affairs in one of my references. She works for the Louisiana State Medical Society, and these were some of her main issues or concerns that came about in the last legislative session. Scope of practice has been a huge issue for Louisiana, and I'm sure for most of your states too. Everyone wants to practice medicine without a medical degree. A hot issue among many states is the Medicaid programs. In Louisiana, if Louisiana is somewhat like your states, you are having some of the same issues that we are, especially in the rural areas. Reimbursement. Not only has our reimbursement gone down, but now there's an issue of co-pays, deductibles, co-insurance in the Medicaid program. We recently went to Bayou Health in Medicaid, which not only did decrease our reimbursement, but it also slowed down payment. There are 4 entity insurance groups in this Bayou Health plan, and there are 2 of them that when you bill them, they pay a percentage of the Medicaid, and then the other, you have to rebill Medicaid to get the rest. So as you can see, it's really put a hardship on cash flow. There's also one other thing I wanted I have not read all 2,000 pages of the Obamacare, but let's see, how many did you say, Doc? 1,999? Anyway, one of the main concerns with rural hospitals now is that there is a clause in there that says that rural hospitals will no longer be reimbursed by Medicare or Medicaid. If this happens, it will shut down rural hospitals. There are a number of rural hospitals in our area that are in a real panic right now because of this. Will it be enforced, or will they get by with it? Like a lot about this one, we don't know. Financial challenges. Again, cash flow with Medicaid reimbursement being held up by the Bayou Health Plan. And things that Medicaid used to cover, prescriptions that they used to cover, they no longer cover. We have about 2 now, about 2 antibiotics, really good antibiotics that we can give Medicaid patients now. We can no longer give them some of the medications we used to be able to because their card doesn't pay for it and they can't afford it. So you're really limited on what medications we can give them. We've seen increasing drug cost. What I used to buy a 30 cc vial of dexamethasone or some of the medications we use in our clinic for $7, I now pay $17, up to $27 more for that. So we've seen a 150% increase in our supplies, in our medical supplies, and also on medical equipment. And yet reimbursement is down. We give an injection in the office, and the patient with insurance says, "Oh, all I have to do is pay my copay. My insurance company said that I will be out no other money except for my copay." Oh, well, yes, your insurance may pay for your injection. On Rocephin, $1.39. I'm sorry, that just doesn't quite cover our costs. And that's what the insurance companies in our area, I don't know about yours, they tell their patients that they will be only out their copays. We had a patient the other day that called their insurance company because we had charged for a Rocephin shot. And he said, "But I was supposed to only be out my copay." So the insurance company called us. And so we quickly told them that it was an injection that was not covered. And we run that battle all the time. It takes staff hours, and it takes my time too. So again, costs are up, reimbursement is down. So what are we doing to survive? Some physicians in our area, 3 major physicians that had full-time practices, recently retired. They retired, one to the VA hospital, the other 2 to salaried positions. Some of them have retired completely and are living off their investments, their retirement income. Some are having to downside. Their lifestyles are changing, selling off some assets and reinvesting. And like I said, some are just flat closing their practices and taking jobs at salaried positions. And frankly, some have moved out of the country. A report with the Accenture in September showed that private practice physicians dropped from 57% in 2000 to 37% in 2012, and an additional 3% is expected in the next 12 months. Those numbers are even magnified for the rural areas. Let me tell you a Louisiana story. 2 years ago, I told this to Paula last night, she's already heard it. 2 years ago, our governor cut our Medicaid, which is 60% of what we see, 18% in May and another 3% in August. And me being the administrator that I am, I was ready. I had cut staff hours, cut salaries. I had bought up tons of medical supplies and pharmaceuticals that I knew that we would need because I knew that the money was going to be less. So I was totally prepared. What we were not prepared for, he made it retroactive back for a year. So we paid 60% of what we made. We paid 21% of that back. Did they work out a payment plan with us and say, how much can you afford to pay every month? No. We just didn't get paid for 6 months. The pediatric physicians, our own Dr. Burris, who I know that y'all know from being president of Louisiana, I know Paula knows, they did not get paid for 6 months because 90% of what he sees is Medicaid. He went through his retirement. He went through all of his investments because he has a much larger clinic. We're just a mom and pop shop, but he has a much larger clinic to support. The physicians in Louisiana were incredibly, especially the ones that take care of those that most need our services. So that's a Louisiana story, and I'm sure that you all have more like them. I want to share this with you. Regardless of what came before or what has yet to come, what matters most right now is how I choose to respond to the challenges before me. I will lie down. Will I lie down or will I fight? The choice is mine, and I choose to fight. In Williamsburg, when I was installed as president, Dr. Hill closed a opening address, and I will never forget his words because they have been always my words. And I thought, oh, he thinks like I do. The words were, when I meet the Father, I want him to look at me and say, well done, good and faithful servant. I just want to share these other pictures with y'all. This is our family. Oh, did I go the wrong way? This is our home. It was a catastrophe before we started working on it. That's our 8 children. And there's our references. Thank you very much.